Welcome to The Explainer. Today, we're diving into something pretty incredible, how India is proactively building one of the world's most comprehensive support systems for its aging citizens. It's a fascinating look at how a country is planning for a massive demographic shift. Okay, first things first, let's just wrap our heads around the numbers. By 2050, India is looking at over 300 million senior citizens. To put that in perspective, that's basically the entire population of the United States right now. It's a huge, huge shift, and it's exactly why we need to pay attention to what India is doing. So the big question is, how on earth do you build a system to support that many people? Well, that's what we're here to figure out. Let's break down India's really interesting, multi-layered strategy. All right, let's get into it. You know, any big project needs a solid blueprint, right? For this national safety net, that blueprint is policy. And get this isn't some new knee-jerk reaction. India started laying the groundwork for this more than 2 decades ago. Back in 1999, they established the National Policy on Older Persons. Then, in 2007, a really critical law was passed, the Maintenance and Welfare of Parents and Senior Citizens Act. These two are seriously the bedrock of everything else we're going to talk about. And what's so important about these laws is the language they use. It's not just about, here are some services. It's about establishing rights, welfare, and protection. That's a huge mental shift. It's moving from thinking of elder care as some kind of charity to seeing it as a fundamental right. Okay, and just to make sure we're all on the same page here, when we say geriatric care, we're not just talking about a doctor's visit. It's way bigger than that. It's a whole specialized field that looks at everything, the physical, the emotional, and the social needs of older adults. So, if policy is the blueprint, let's look at how the actual safety net is woven together. And like any good net, it has these super strong main threads holding it all together. In this case, those are healthcare and financial security. And you can see this two-pronged approach really clearly here. On the one hand, you've got healthcare access through something called the National Program for Healthcare of the Elderly, the NPHCE. It's all about dedicated medical services. And on the other hand, you have financial security. Schemes like the Indira Gandhi National Old Age Pension Scheme step in to provide direct financial support, especially for the most vulnerable. And that healthcare program, the NPHCE, it's not just some idea on a piece of paper. We're talking about real physical infrastructure. They're actually building specialized geriatric wards in medical schools and district hospitals. The whole point is to make sure that care designed specifically for older people is there no matter where you are in the system, from your local clinic all the way up. But here's the other brilliant part. To make sure a health problem doesn't turn into a financial disaster, there's another layer woven in. Health insurance programs, like the huge Ayushman Bharat scheme, are there to help cover major medical bills. This is absolutely crucial for protecting a family's life savings. Okay, so you can have the biggest, strongest safety net in the world, but it's useless if people can't actually reach it, right? So now let's look at the finer weave, the community and digital systems that bring all this support directly to the people who need it. And you can see here that support isn't just one thing. It's this whole web. You've got your in-person places like daycare centers and old age homes. You have care that comes right to you through home-based initiatives. Then there's the whole digital side with telemedicine. And so importantly, you have advocacy groups, NGOs and councils fighting for their rights. It's all these pieces working together. And honestly, this digital part is a total game changer. Think about it. Platforms like eSanjeevani allow for teleconsultations. For an elderly patient, not having to travel for a doctor's appointment, that's not just a convenience, it's a massive barrier that's just been removed by using pretty simple tech. So, the net is in place, and it's catching people. But the work isn't done. The big focus now is how do we make it even stronger for the generations to come? Well, India is zeroing in on 3 key areas. And the strategy is super clear and smart. First up, train the workforce. You got to have people who know what they're doing, so they're putting geriatric medicine right into the curriculum for doctors and nurses. Second, promote preventive wellness. I mean, the best way to treat an illness is to prevent it from happening in the first place, right? So there's a huge emphasis on things like yoga, physiotherapy, and good nutrition. And third, don't reinvent the wheel. They're actively adopting the best practices from around the globe, like from the WHO's Decade of Healthy Aging. And when you boil it all down, what's the ultimate goal of all these interconnected systems? It comes back to 3 really powerful words: dignity, inclusivity, and resilience. That's the whole point, to make sure that aging is a process supported by those 3 pillars. So let's just recap for a second. The most important thing to remember is that this isn't just one or two little programs. It's a massive interlocking system. You've got the laws, the national health missions, the pensions, community care, financial protection, digital tools. I mean, the list goes on. Everything is designed to work together to provide that complete, holistic support. And that brings us to the final big picture thought. As pretty much the whole world gets older, India's journey here offers a really powerful blueprint. It really leaves you wondering, as other nations face this same demographic future, what can we all learn from India's approach to aging with dignity?